Hi guys, it's Harry again. So in today's community chat, I got Dr. Kuljit Johal. He's my brother and he's a principal GP in Shepshed. So hi Kuljit.
Hi Harry.
How are you? You okay?
Yes, I'm very well, thanks.
Brilliant. So the main purpose of this chat is just to have a general overview of what's going around in NHS, just to get the insight into NHS and obviously what people can gain, what's going on through your knowledge, basically, so have a little bit of overview of what the conditions are in COVID-19. So obviously, I'm going to ask you the question which is on everybody's mind at the moment, COVID-19. So it's had a massive impact in such a short time, obviously, and there's a bit of panic around and stuff. So what is this COVID-19 really, and why it is so contagious?
Yeah, there is a lot of press about this. It's a respiratory virus. It is very contagious, more so than the other viruses that we have come across. And obviously there is a lot of press about this. I think. Obviously, in terms of what to look out for symptoms-wise, classically, patients may have a temperature, a dry cough, a persistent dry cough, or breathing difficulties. I think with regard to the cough, some patients may have the normal cough, but with COVID-19, they would have a new worsening of the cough. So that's the main symptoms to look out for. But again, a lot of patients present in many different ways, so you could get a mixture of symptoms. There is a lot of information on the NHS website, which allows you to check and see whether your symptoms could be coronavirus related, and they can then guide you in terms of what to do next.
Okay, so just touching upon that, Kuljit, about the symptoms, especially. I believe you actually contracted this and recovered, and obviously being in NHS, you were tested positive. So we'll do the testing part. So obviously that was a horrific experience, I think. But I think you had mild symptoms rather than blown. So people do worry that if they contract this COVID-19, obviously they should take precautions, but there can be mild symptoms as well, right?
Absolutely. I think this is a very important message and a good point that you've raised. A lot of patients worry that if they catch coronavirus, they'll end up in hospitals, they'll end up being ventilated, which is not true. I think what people have got to remember is that majority of the patients, probably more than 80% of the patients, will have mild symptoms. They'll manage at home. In my case, obviously, I did test positive for coronavirus more than a month ago, and for me the symptoms were temperature and body aches. I didn't have any breathing difficulties. I may have had a very slight cough, but again it was quite mild, so I was lucky that it was mild symptoms. Unfortunately, being an NHS worker, I was able to get tested and the results came back negative. Came back positive. And I think the key thing really is to recognize that you may have symptoms, and once you have symptoms, you have to isolate yourself from work and ideally from family to avoid this passing on to other people. Thankfully, in my case, I did that, and the virus stayed with me and finished.
Wow. Okay, so in terms of testings now, we touched up. Like if somebody wants to get tested, how long they have to display these symptoms before they can get tested, Kuljit?
There is a lot of testing available now. I think anybody above the age of 65 or anybody who is an NHS worker or a key worker can request the test themselves. I understand there is a government website. You can register for the test, just enter a few details, and they will then arrange for you to go to one of the local drive-through facility and be tested. I think ideally the test should be done within 3 to 5 days of the symptoms. So once you know you could have coronavirus symptoms, just go to the NHS website. It will say to you whether you could have coronavirus, and it will also tell you how you can arrange the test.
Okay, brilliant. One thing I wanted to ask you, Kuljit, obviously because of all this coronavirus going at the moment, everywhere it talks about that. But there are other health conditions obviously affecting people, like flu or fever or any other health conditions. And should they still be contacting their GPs? And how does it work? I mean, like, can they just walk in or just a telephone appointment?
Yeah, I mean, absolutely. Very important question. I think what people have got to remember is that, we are still open. General practice is still open. We are still dealing with the other non-coronavirus problems. So we have changed a lot of practices in Leicester and around England and the UK have changed the way they are working. Mainly to do with the coronavirus situation, because we are trying to reduce the risk as much as possible, reduce the risk of patients catching coronavirus when they come to GP surgeries, or the risk of staff catching coronavirus. So we are doing a lot of telephone triages and video consultations. So if a patient needs to talk to us about their other health problems, which is nothing to do with coronavirus, they ring the surgery. Receptionist will ask some questions, and they will ask a GP to call the patient back, and the GP will then try and sort it out over the phone if they can. If the patient needs to be seen, they will try a video consultation, and if they feel that the video consultation doesn't add much to how they would want to proceed, then they may even ask the patient to come into the surgery to be seen. At the moment, we are not seeing many patients because we are pretty good at triaging them over the phone safely. However, if patients do need to be seen, we do see them. So it's very important that patients don't think that the GP surgeries are closed, they can't come in. We are still here to treat all of the other health problems that they might be having.
Another thing I wanted to ask was, Kuljit, because you guys are actually actively working on the front line and obviously people are visiting you. So how are you keeping your staff safe, NHS staff, and also the patients who are coming to see you then?
Yeah, so obviously one of the things that I've touched upon is reducing the footfall and the way that we are actually consulting. So reducing the number of patients coming in, heavily relying on technology, just like Zoom, remote consulting is what we're doing. If we do have to see patients, we have got personal protective equipment, such as the surgical face masks, the visors, gloves and aprons, for staff protection and patient protection to wear. The receptionists are protected because we have a member of staff at the front of the surgery who is asking patients questions in terms of why do they need to come into the surgery, and if that member of staff can actually signpost them to a local pharmacist or go home and ring the surgery, she will do that. So we are taking precautions from that point of view, and within the surgery, obviously, we've got plenty of hand sanitizers, making sure you keep a distance. Even within workplace, we are making sure that staff are not sat together in the same room, or there's a minimum distance between them. So trying to take as much precaution as possible, and thankfully, I think we're doing a great job.
Would you advise now, obviously people are in lockdown, they are at their homes and stuff and still practicing social distancing, so shall we just continue with the social distancing and follow government guidelines which have been given to us?
I think that's very important. Obviously, we're doing this to reduce the burden on the NHS. It is very important that we continue to follow that, because the last thing we want to see is another spike in the number of cases. I think obviously we are all aware of the graph and the peak. We are currently past the peak. So it's heading in the right direction. I mean, sadly, there are still a lot of patients passing away. And we want to keep those numbers to continue to come down. It's very important to follow the latest guidance given by the government and to continue practice social distancing.
Well, Kuljit, thank you so much for coming on and having a chat. Oh, we do appreciate your hard work, and thank you so much for looking after us and the community. Thank you, Kuljit.
Thank you, Harry. Thank you.